Right. Thank you so much. And thank you all for giving me the opportunity to come back and spend some time with you this morning. And I'm going to be talking to you today about an area of interest and research that I focus on. And it is merging the concept of epidemiology, which is measuring disease, with adverse childhood experiences, or ACEs. And I'm going to show you what we've done in Oklahoma here at OSU measuring trauma in Oklahoma. But if you're not from Oklahoma, don't worry, I still think it's going to be very informative and helpful for you to understand kind of the concepts of measuring trauma. I hope everyone here is familiar with ACEs, but it's an incredibly important topic. And so we're going to kind of back up and build a foundation on what ACEs are. We're going to talk about measuring them and then the preventative measures once we do. So the first thing I have to do is just kind of highlight you as to the top 10 causes of death in the United States back in 2019. And if you look at it, it's a heart disease that most people die of a heart attack or other related event, followed by cancer. And then look at the numbers. You go from 700,000 to 600,000 pretty rapidly down to 173 with accidents like overdoses. And then you get into your respiratory diseases and then some others. But I just want you to really look at this list and study it for a second and think of what causes these diseases. Like, what do you know about the root cause of Alzheimer's? And why do people get diabetes? And what are the risk factors for pneumonia and suicide? Well, we know that 2020, we have a new leading cause of death, the United States, and that is COVID. Has jumped up this list, and these are old numbers now and probably would be much higher. But you see 659, 599. Well, in 2020, 345 due to COVID. And then I want you to think about what you've heard about the social determinants of health when it comes to COVID and how it disproportionately affects some people more than others. Let's break it down by age. And if you look at the top 10 or the top causes of death for younger people, 1 to 24 years of age, it's accidents, motor vehicle accidents, and so on. And as you get older, it becomes much more likely to have cancer and then heart disease. But again, just look at the top causes of death. They're similar: accidents, cancer, heart disease, suicide, homicide. And if we could find a way to solve those problems, then we could really make a dent in mortality in the United States. And so I'm going to ask you, what is the common thread behind all of those conditions? What pathology does an accident, suicide, homicide, heart disease, what do they share? Well, the answer is behavior. Okay. So go back and now you look at this and even this list and think about how an individual's choices determine whether or not they have this disease and how bad this disease is. So heart disease is directly related to our behaviors of eating and our behaviors of exercise. And it turns out that those are more important than our genetic load for heart disease. Cancer is highly correlated with cigarette smoking and our choice to choose that behavior to smoke. Overdoses are highly correlated with our behaviors. COPD is cigarette smoking, and so on and so on. Diabetes with diet, suicide is a behavior in and of itself. So the common thread of the leading causes of, so it's not that we have a cholesterol problem in the United States. We've got, and it's not just the United States, it would be similar around the world. We've got a behavior problem. We've got a behavior problem. And we know that some people have different behaviors than others. Well, I'm an addiction doctor and really kind of like a public health addiction doctor. And looking at how do I prevent addiction? Well, you got to find out who's going to become addicted? And it turns out that it's all about your early childhood experiences and that trauma that you experience as a child. So we had in 1998 a groundbreaking article that I think is probably going to be one of the biggest paradigm shifts in medicine over the next 100 years. In my mind, this is the silver bullet. And it explains why people get sick with medical and mental health diseases. And so this is the original study here. You see it was in the American Journal of Preventive Medicine by Folletti and Anda and some other important people, but really these are the people that get the most credit. And it's called the Adverse Childhood Experiences Study. And so this is the first time that we put that concept together. I'm going to go through the study a little bit. Here is their conclusion, and this sentence here says everything you need to know about ACEs. We found a strong graded relationship between the breadth or amount of exposure to abuse and household dysfunction, which was incredible that the original ACEs study added that. We've known for a long time in psychiatry that like childhood sexual abuse leads to bad outcomes as an adult. Right? We didn't need the ACEs study to tell us that. What we were not paying attention to was divorce and parents with mental illness and parents with addiction, domestic violence in the household. And the ACEs study added all that together. And they said it's graded, it's stair step. The more trauma you have, doesn't matter what trauma, it's just the more trauma you have, the more likely you are to have bad outcomes as an adult. So let's go through the original ACEs question. So this is the ACEs questionnaire that they administered as a survey. And I've got over here the percent of people that answered yes to that question. And so you have psychological abuse, such as parents swearing at you, insulting you and putting you down, and or threatening you. And I'd like to really highlight what that question is getting at is when your parents are treating you that way, it's hard for you to feel loved. And we know from PACEs that really an important component of childhood is feeling like you have somebody that loves you. And so 10% of adults that answered this question when they were a child, they were insulted, they were psychologically abused, and they were threatened. And then high rates of what we would call child abuse now. And I say that, I think that our awareness of child abuse has dramatically increased over the last 20, 30, 40 years. That 50 years ago, it was okay to leave marks. Strong discipline was kind of cherished. And now we know that that's not true. And the way we punish kids 50 years ago was child abuse. It's child abuse now, but also it was child abuse then. And we just now realize that a lot more. But probably one of the most concerning things from this study is the incredible rates of sexual abuse. 20% of kids were sexually abused in this Southern California privately insured population. So think about what that would be in Oklahoma in a rural non-insured population. Highest rates of substance use, very high rates of substance use. High rates of parental mental illness. We asked about domestic violence. And then a very important question for Oklahoma is how often did a household member go to prison, right? Because Oklahoma has incredibly high incarceration rates. And the numbers are getting much better over the last few years. But, a few years ago, we led the country in male incarceration rates, and we led the world in female incarceration rates. And what we don't understand is that we're locking up mothers. And that is creating trauma in the offspring of those mothers and actually increases crime because children whose parents are incarcerated are more likely to commit criminal acts. And there have been studies that show when you lock up a mother, it takes about 3 generations to recover, for that family to recover from that trauma. Okay, so here are all of the different categories put together. All told, 50% of respondents experienced at least one category. A lot of people have multiple categories, and we'll go over that in a second, but you see substance use followed by sexual abuse. And that's just incredibly alarming to me as a psychiatrist, because childhood sexual abuse is incredibly damaging to a developing brain. Very traumatic experience. So that's the, the exposure. What about the outcomes, right? What about the outcomes? And you see that as the number of ACEs increase, the more likely you are to smoke cigarettes, which means the more likely you are to have heart disease, the more likely you are to have cancer, the more likely you are to have those lower respiratory diseases. So I want you to look at the stairs. Okay, and you're going to see that as we go through the rest of these conditions. Stair-step approach. Severe obesity. No leisure time or physical activity, so it's going to be harder for you to lose weight. Prevalence of major depressive disorder. Almost 1 out of 2 people who had 4 or more ACEs have major depressive disorder. Ever attempted suicide? Look at that. If we would not traumatize our children, we would not have a huge problem with suicide in the United States. And what you should know is that suicide has dramatically increased over the last 20 years. Ever had a sexually transmitted disease, including but not limited to HIV? Okay, heart disease, about 20% increased risk from trauma, again, related to cigarette smoking and diet and exercise. Stroke, lower lung disease, diabetes, alcoholism or alcohol use disorder. Ever used illicit drugs? This would include marijuana, but we can get a little bit more detailed with injecting drugs. And as an addiction doctor, I'll tell you that injection drug use is like kind of the end result of drug use. It's what happens right before overdose. It's really, really, really bad. And so that is highly correlated with early childhood trauma. Right now, Oklahoma's leading cause of overdose is methamphetamine, which is mostly injected. And so if we want to stop the leading cause of overdose in Oklahoma, we've got to stop the childhood trauma. Okay, so those are the exposure and the consequences. And the CDC has put all this together in a conceptualization that we call the ACEs pyramid. And the ACEs pyramid starts with the actual experience, right? And then that changes the brain. It literally changes the brain. And we've got a whole set of investigators in Oklahoma, both at OSU with Jennifer Hayes-Grudo, Julie Croft, Amanda Morris, and even people at the University of Oklahoma. They're all looking into this. And a lot of the science is right here. It changes your brain. And we can look at a brain scan of someone who did not have trauma. We can look at a brain scan of someone who had trauma. They are different. They are different. And those differences lead you to adopt health risk behaviors. So we know that the brain doesn't fully develop until the age of 22 to 25. And it develops from the back to the front. And so the front of your brain, your frontal lobe, is the very last thing to develop. And that, unfortunately, is your good decision maker. So the very last skill that you learn is how to make good decisions. And so these pathways from the different areas of your brain get disrupted when you are traumatized. And that causes you to, at an early age, like the age of 12, 14 to 16, adolescence, early transitional age youth, to smoke cigarettes, to hang out with the wrong crowd, to drink alcohol. And the earlier you expose your developing brain to a substance, the worse your prognosis is from addiction. And if you build in healthy behaviors like exercise early on, you're more likely to have those into adulthood. The same with diet, that early on, we recognize that some children find a therapeutic benefit, not only from quantities of food, but from the types of food, right? The unhealthy food. And all of that is related to having an adverse childhood experience. Well, those behaviors cause disease and social problems. And those problems is what leads to early death. And that's what we're worried about. Obviously, we want to stop the trauma, but that's how we stop early death. Well, Oklahoma, good news, is leading, like we do with most bad things. I'm still waiting for good things. Anyone know of like a good thing that Oklahoma leads in? Maybe like the biggest bass caught in a lake. Maybe we're number one with that. I love Oklahoma. I'm sure we're good at a lot of things. In fact, we just won the Little League World Series. There we go. So we have that going for us. But when it comes to bad things, Oklahoma always leads the list. And when it comes to trauma, studies have shown that Oklahoma may be the worst state in the country. That our children are growing up in the most traumatic households ever. The most traumatic households in the country, right here in Oklahoma. Okay, and so when you look at, we also have the highest rates of diabetes. Well, of course we do, right? Because diabetes is a direct result of behaviors that you do because you're traumatized, and we traumatize our kids, right? So we traumatize them, and then we really don't have an effective system to treat the trauma for kids, but then also to address it as an adult. And so we incarcerate. And that can help you understand why Oklahoma has the highest incarceration rates. Okay, so there have been some studies that have looked at this. And so the best counties to live in may be right here. I've got the top 10 for you. And those are, very much Western, very rural. Okay, and then you look at the worst ones. And these are Southeast Oklahoma, right? Pushmataha, Choctaw, McCurtain County, that's where I'm from. And I can definitely agree with this ranking. We do have Western County out there. But there have been some studies that are older that showed Southeast Oklahoma is the third poorest region in the United States. The first would be South Texas, like Brownsville. The second poorest region would be Appalachia, followed by Southeast Oklahoma. And you see that it really shows up here on adverse childhood experiences. Okay, so how do we fix it? So I'm not just here to give you bad news. I'm here to try and tell you that I think that there is a solution. And I'm a big fan of prevention and a public health approach to disease. And the number one thing you need to be able to do is measure. You have to be able to measure any kind of exposure. So when you measure, you create a surveillance system, and that's what we're doing right here at OSU. And the hallmarks of a good surveillance system, as it relates to adverse childhood experiences, I think is, first of all, a zip code level surveillance system. That counties are really good when you're looking at these counties, but if I put Tulsa County up here, that really wouldn't tell you much, because there is such a dramatic difference in the demographics of North Tulsa zip codes compared to South Tulsa zip codes. And I can't do a prevention program just for Tulsa County. That'd be very expensive. That would be you would be targeting South Tulsa that doesn't have very high rates, when you should take that money and double those efforts in different zip codes like North Tulsa, who need prevention programming the most. So I really do think we need zip code level that can then be recreated at the county level. It has to be regularly updated. And what you see when you get into the ACEs measuring is that there are a lot of studies such as these that are done once, like a survey, an analysis one time, and then we're done and we move on. But nobody's looking at the change. And are we getting better? Are we getting worse? And what's happening to different places as, like, let's say COVID hits, or we've had a lot of criminal justice reform in the last few years. How has that changed outcomes? We need to be measuring that. So a good system needs to be regularly updated. And then we need to be able to compare, because it's not good for me to just tell you, here's the rate of trauma in the zip code. Well, okay, but how does that compare to the rest of the state? How does that compare to the rest of the country? So you have to be able to compare it to other zip codes, other counties, and whatnot. And so that's the approach we took when we started to develop this system. We were able to measure. So the most common way that ACEs are measured is either through a survey or through a questionnaire when you go to the doctor. And so we're only capturing very, very small people. So our system actually backed out and said, are there public health sources that we can use as metrics for these ACEs? And can we extrapolate this from somebody else, from other ways, right? So instead of asking people, do you drink alcohol? Are there other available data sets that say, these are how much, this zip code is consuming alcohol compared to this zip code? And that's what we did. And we were able to get information for these ACEs. We're working on the other ones. Okay, and I've blinded this zip code because it has like 3 people in the zip code. And I think, you'd be able to tell who was drinking a lot of alcohol. So we blinded that. But these are the top 10 zip codes in Oklahoma for substance use, as measured by having a substance use diagnostic code in the Department of Mental Health and Substance Abuse Services data bank. So really community mental health centers, which is not only our safety net system in the big cities, but also our community mental health centers are the providers for most of Oklahoma, because even like in McCurtain County, there's not a psychiatrist there. So you're gonna go to the community mental health center, whether you have insurance or not. So I do think it's a good metric to compare zip codes to zip codes. And you see a dramatic increase in zip code here, but this county also has less than 30 people. So that may not be an accurate, that may be overrepresented. But we do have top 10 zip codes. And I think these are accurate representations of zip codes that we need to focus on for substance abuse. Okay, so let's look at that as a map. And I'm going to show you a lot of different maps here. And on my maps, red is bad. That has absolutely nothing to do with OU being red and OSU being orange. I promise. It has nothing at all to do with that. Not intentional. Maybe a little bit. Okay, so these maps, you've got the category right here, substance abuse, and you've got the prevalence, the raw count per 100,000. And then you've got the year. And our system goes back to 2010. So I'm going to show you not all of those maps, because that'd be hundreds of maps, but we're going to show you some of them just to give you a taste of the surveillance system. And just by looking at it on the map, you can see some hot spots, right? Like over here, And our map is interactive, so on the live version, you could click here and find out exactly what those numbers are. But you can really see some consolidated efforts. And if I was doing prevention programming, man, we could make a lot of difference with a little bit of money right here in this area, instead of just saying, let's do an Oklahoma campaign. Okay, what about the percent change from 2017 to 2018, right? And you can see that like something happened in this county, right? And I can tell you from also from the methamphetamine epidemiology in Oklahoma, they had a huge increased rate of methamphetamine overdoses. So the panhandle, something's going on out there and we should investigate that. Okay, and then standard deviations from the state average. If we make the state average, 0, then these are the outliers, right? These are the outliers, which also looks very similar to the prevalence. Okay, what about mental health? Well, the number of people per 100,000 accessing our community mental health centers. And again, you see some real big outliers here. Let's look at our maps. Right, and so here with this zip code specifically, I would really want to drill down on exactly what those diagnoses are, what those individuals are accessing services for, and developing a prevention program specifically geared towards that. That could be very, very inexpensive compared to, let's do a prevention analysis of the entire state of Oklahoma, right? But like these counties maybe don't need that right now. Not saying that we shouldn't, direct resources to the blue counties, but when you're looking at mental health prevention, we don't need to do that right now for this county. We need to do it for that zip code. We need to do it for this zip code up here in Northeast Oklahoma. Let's use our limited resources very, very wisely. Okay, in percent change, these are the zip codes that are getting worse for mental health. And so let's drill down and find out why. Okay, the next is domestic violence, right? And incredibly traumatizing to a child to see dad hit mom. And Oklahoma leads the nation in domestic violence and domestic violence homicide. We're in the top 5 for that. So here are the zip codes, just where prevalence rates are. So I'll tell you where we got this. You can go to the Oklahoma State Courts Network, OSCN. You can just go up there and search for a court record. You can put your own name in there and find out all the times you've been arrested or have entered the court system for most of the counties in Oklahoma. And I can see a lot of you now like Googling your brothers, your sisters, your friends. It's entertaining for sure. And you can go and look at those, and but actually it even has an API, like a data feed that you can plug in and you can mine that data. And that's what we've done. And out of that data, we mined domestic violence charges in Oklahoma. And so these are the zip codes that had a higher rate of domestic violence charges per 100,000 than others. Okay, so there are some domestic violence problems going on in these areas. Okay, and the percent change, so domestic violence increased quite a bit throughout all Oklahoma from 2017 to 2018. And we have a study in a submission right now showing that that actually increased with COVID. And we had a similar study that we published out of OSU for child abuse, showing that child abuse increased during COVID. And the author of that was Hartwell, H-R-T-W-E-L-L. And I think we co-authored that with some OU investigators, child abuse investigators. So that'd be a good publication for this group to be aware of. And then, so this is prevalence, this is change, or it's getting worse. And this is the hotspots by just standard deviation, right? That we capped it out, but like these counties are greater than 14 times standard deviations above the state average. Incredibly high rates of domestic violence. All right, we look at divorce by zip code. And this is a problem in Oklahoma. And this is a big problem that we ran into in our in constructing this data set, is that just getting the data. And divorces in Oklahoma are only measured, you're only ever able to attain that by county level. So we did statistical extrapolation using census data to get them down to the zip code, but there's a built-in inaccuracy with that. But when you go and file for divorce in Oklahoma, they don't ask you anywhere on that paper your zip code, your home address. It's all what county do you live in. So this data can't even be measured by zip code. And the best we can hope for is at the county level. R.M. McCracken is asking, will that publication be released, or has it already? Yeah, R.M. It has been published, and I think if you Google Hartwell and child abuse, you should come up with the study. And it also made the local Tulsa press, so you might see some references to it. I wish I had the reference and I'd give it to you, but unfortunately I don't have that readily available. And Gina's asking if the PowerPoint will be made available, and we'd be happy to give that to Dejan so she can make that available to you guys. Okay, so these are the zip codes where divorce is high, and we want to look at that. We want to look at that. So looking at our maps with divorce, these are the high rates by 2018. Again, we mined this out of the OSCN data, and also worked with some statewide, other statewide agencies that collect this data. And I think, Meg, did you put the article there? Yeah, Meg put the link to the article so you guys can go and look that up. Okay. And then we look at change. Oh, sorry, I'm getting ahead of myself here. So we look at where divorce is getting more prevalent, right? It's here. And so today's divorce, 10 years from now, this is where your opioid overdoses are going to be. This is where your alcohol is going to be. This is where your crime's going to be. So if these consistently stay elevated, that's where we need to really, really double down our prevention efforts so that we get better outcomes. Because it's also not just crime and addiction, it's diabetes and it's cancer. And this is where it is. If I was in the cigarette selling business, this is my market analysis. This is where I go to hang out, next to the high school in my leather jacket and shady sunglasses and say, hey kids, you want to try something cool? Because this is where your customers are. These are where the kids are going to be more likely to adopt those health risk behaviors. And change in standard deviation. So these are the outliers for the state. And then child neglect, we worked with our colleagues, our friends over at DHS, and there's an incredible amount of inaccuracy in this for all of our child abuse and child neglect data, because when we get it from substantiated child abuse reports. So it is just people claims that have been substantiated, because we know that there's a lot of claims that are not substantiated, and we don't want to do that. So these are substantiated claims by zip code, and very, very high level of neglect. But the question is this where the neglect occurred? Is this where it was reported? Or is this where the perpetrator lived, right? And so if you look at where it was reported, if you look at a lot of the child abuse rates, they're in South Tulsa. And you're like, oh my gosh, South Tulsa has a lot of child abuse. No, right? South Tulsa has a lot of pediatrician, and it's got the children's hospital with a child abuse service, right? Obviously, they're going to report more. So you have to recognize that the system is not perfect, but it's equally imperfect, that we're measuring inaccurately, but equally all zip codes. So I do think you can compare zip codes to each other, but the raw numbers may not be accurate. Okay, and then here we have prevalence per 100,000 for neglect. And also this might reflect, the bandwidth of DHS. We know that DHS is incredibly overworked and underpaid, and also at the mercy of turnover and whatnot. So just know that that might reflect in this data. And the change from 2017. And then standard deviation change. Physical abuse, right? So this is not sexual, but it's physical abuse, which, hitting a child so hard that they would leave a mark. But again, these are cases in which DHS investigated and said, yes, this is child abuse. This is child abuse. So we have our top zip codes here and just the numbers, right? So 2018, 529 children per 100,000. And that just kind of breaks my heart. Here are the hot spots. We're gonna, I think, zoom in a little bit on Tulsa. Here's the change from 17 to 18. And here is deviation from the statewide average, right? Really, really obvious hotspots of places that we need to look into more. And when you look at this, I would look at consolidation of neighboring zip codes. And so these areas here are the, where you have multiple zip codes close to each other. That's what I'm worried about, right? Oklahoma City area, a lot of zip codes. Okay, and then we can kind of standardize all of those ACEs, and we can measure them as like a totality. Like, okay, when you put it all together, which zip code has the highest number of ACEs? And we call that the all ACEs score, AAS. And so you see that this a very small zip code, less than 30 people live in this zip code, has a very high all ACEs score. Going down to 141. So if you put it all together, here's where you're looking at is some really high prevalent zip codes. And this one has shown up time and time and time again for a lot of our different ACEs. So I'm not surprised to see it there. And we've seen a lot of this one here. In change, these are the ones that are getting worse. And then standard deviation. Again, if I was going to open up a McDonald's, I would go here, right? Because these are the people that are going to be looking for unhealthy diets. Also, if you wanted to start a diabetes clinic and whatnot, here's your future. Here's your future. Okay, so where do we go from here? And once we know where the trauma is, we can take steps to prevent it. And when you talk about prevention, you have primary, secondary, and tertiary prevention. And primary prevention is preventing it from ever occurring in the first place. And we know that there are, ways to prevent like domestic violence, right? Like anger management and, education on appropriate boundaries for high school athletes. And a lot of other community-wide programs for domestic violence. Well, if we blanket a community with that, whether they are actually involved in domestic violence or not, that's called primary prevention. Like vaccinations are primary prevention. And we need to do that for all of our different ACEs. Secondary prevention is identifying the exposure in individuals that don't have the bad outcome, right? So like when we do like just blanket COVID screening, right? Whether you have symptoms or not, we're just going to screen everybody for COVID. That's secondary prevention. And we need to be doing that for trauma, right? We need to be looking at and asking children regularly at every doctor's visit, are you being abused? Are you being threatened? Have you witnessed domestic violence? And we can do that through the ACEs questionnaire. But that would be secondary prevention because they may have perfect grades. They may not have diabetes, but we identify them as being at incredibly high risk for bad outcomes. And then we provide them counseling and other services so that we prevent that negative outcome since they've had the exposure. And then the tertiary exposure is what, where I live, is treating people with, or the tertiary prevention is treating people who have addiction, treating people who have diabetes. I like to call tertiary prevention the US healthcare system, because that's what we do. We put all of our money and resources and intention and focus at where we get the littlest bang for our buck, right? But we've got huge hospitals for the bad outcomes of trauma. We've got not a single hospital directed towards preventing trauma. And we should have cathedrals in Oklahoma built towards trying to prevent the trauma. And we do. I don't want to say that we don't have anything. We've got a lot of great university, nonprofit, state agencies. We've got a lot of people focusing on this. It's not anywhere near the amount of money that's going towards healthcare, right? And it's like our seesaw is topsy-turvy. It should be, we shouldn't have to spend a lot of money on health outcomes because we should be spending most of our money on prevention. And you would get tenfold bang for your buck if you focused on the upstream factors, Okay, so in conclusion, ACEs might be the smoking gun that we've been searching for, the golden ticket, the silver bullet of preventing mental health outcomes and all of the bad things in the world. You name a bad thing, diabetes, cigarette smoking, cancer, the Yankees winning the World Series, and I promise you it comes from ACEs, right? We can prevent that through preventing childhood trauma. And then if we can measure it, we can fix it. We've started the first statewide zip code surveillance system. By the way, I need to call it something besides the ACEs surveillance system, which comes out as ASS, because that's just not a good catchy phrase. So if anyone has any good ideas, let me know. We've started it. We are measuring it against other data sources to see how accurate it is. And we're perfecting it. And we're working with our state agencies and better data collection so that we have a more accurate snapshot into why Oklahoma leads the country in childhood trauma. With that, I am happy to answer any questions. Okay, let me go back to the chat and see what I missed. Linda says, so glad to see that we're working on zip code level data. Please let us know how we can access it. That your foundation is working with some self-healing communities who would benefit and do needs assessment. Yeah, Linda, if you will just email me at my email address there, I'd be happy to work with you. We do have data sharing agreements that have confidentiality protection and all of that, so we're limited on what we can share. But ultimately, we would like to put those maps that you just saw on a public-facing website that would allow you to get that. We're just working through those technicalities right now. Happy to help you though. And thank you for the work that you do. Cheryl says, this information supports the concepts that we should work together across the state with all agencies and organizations to address ACEs. If the agency collecting data could change formats with reporting to capture valid zip codes, we will only know how well our efforts are if we have accurate information collection. Yeah, absolutely, Cheryl. We have in data science, we have the saying, junk in equals junk out. So if the data is inaccurate coming in, then it's going to be inaccurate coming out. We here at OSU, we have a very large effort towards ACEs and the Center for Integrative Research on Childhood Adversity, CIRCA. which is an NIH grant led by Dr. Jennifer Hayes-Grudo, who wrote literally the textbook on ACEs, her and Amanda Morris. It's a great book that tells you everything you need to know about ACEs. And so we're working to change data collection. I got to tell you, state agencies have been very, very responsive. I haven't heard anyone say, no, we don't want to do that. They've been incredibly responsive. Michelle, you are welcome. Laura says, would like to see the info shared with churches, schools, and everyone affected. And I couldn't agree with you more, Laura, that one of the reasons we got down to zip code is because most zip codes have that local entity, right? Like a post office, a school, a church. And so there actually really is hope that you can get to these small entities of zip codes and you can affect a change, because you can have a community meeting on a Thursday night in a small zip code in a rural Oklahoma town, and a lot of people will come. The message will get out. And so I think that that's one of the reasons we got to zip code level. Now, when we get to the urban areas, Tulsa, Oklahoma City, we're gonna have to tweak it a little bit, but I've got a lot of good ideas on how we do that. So we are just now getting started. Stay tuned, and hopefully over the next few years, we'll have very robust data and prevention analysis for you guys.